Good morning, everyone. Hope you all are doing well. So, the topic for today's lecture is classification of malocclusion. Before we move on to that, let us see and know more about this quote, which goes like this: the beginning of wisdom is to call things by its right name. Which, in other words, if we apply in our day to day life, if we want to explain any problem or any description about a topic, it is always better to classify it and call it by its right name. So we will begin with today's lecture, classification of malocclusion. Introduction. Classifying means distributing a topic into different classes or groups according to a given classification method or system as given by Ferreira in 1986. The act of classifying can render a given subject or pursuit more objective, understandable, and consistent even if studied or analyzed by different people. It was given by Moyers in 1991. This classification system is a group of clinical cases of similar appearances for ease in handling and discussion. Malocclusion, as defined by World Health Organization, it is a handicapping dentofacial anomaly. It is defined as an anomaly which causes disfigurement or which impedes function and requires treatment. Today, malocclusion occurs in the majority of the population. It is neither a normal nor unhealthy condition as defined by Profit and Fields in 2000. So now that we know about introduction and what is malocclusion, let us know why we need to classify the malocclusion. Now, classification, as all of us know, is an essential communication tool between professionals. Classification aids in the diagnosis and treatment planning of malocclusions by orienting the clinician to the type and magnitude of the problems. So, when we have a malocclusion, let's say in orthodontics, when we classify and we know further about it more and more, we can plan the diagnosis and treatment plan of the same, as well as it helps us to communicate between our fellow colleagues when it simplifies the ease of explaining the same. Now, types of malocclusion, they are basically classified into three main types: intra-arch malocclusions, inter-arch malocclusions, and skeletal malrelationships. Now, intra-arch malocclusion means when you see the malocclusion in the same arch, let's say the malocclusion is present in the maxillary arch itself or in the mandibular arch itself, like there's spacing in the maxillary arch or crowding in the mandibular arch, it is called as intra-arch malocclusions. Inter-arch malocclusion means when it is between two arches, that is when you see deep bite or open bite which is present both between the maxillary and the mandibular arch, it is inter-arch malocclusion or between the two arches. And skeletal malrelationships. Now, skeletal malrelationships means when the malocclusion involves the maxilla or the mandible, that is any of the jaw bones or the skeletal jaw bases, it is called as skeletal malrelationships. Now, coming to intra-arch malocclusions, we need to orient ourselves with few terms which are commonly used in orthodontics while classifying malocclusions. Let us see that. First is mesial inclination or tipping, which means that the crown of the tooth is in a mesial direction or is mesially inclined. Distal inclination or tipping, which means the crown of the tooth is in a distal direction or distally inclined. Lingual inclination or tipping, when the crown is in a lingual direction. Labial or buccal inclination or tipping, which means that the crown has moved in a labial or buccal direction. Labial when it is in the anterior part of the oral cavity, and buccal when it is in the posterior part of the oral cavity. Infraocclusion means that the tooth has failed to erupt to the normal occlusal level or table, and hence it is below the occlusal table. Supraocclusion means the tooth has erupted beyond the occlusal table. Rotations, these are the tooth movements around the long axis of the tooth. They are of two types: mesolingual or distolabial and distolingual or mesolabial. Transposition, when two teeth exchange their places in the dental arch, it is called as transposition, which means that, let's say, the normal eruption sequence is a central, lateral and canine. Now, when the canine erupts in place of a lateral incisor, it's called as a transposition. That is, the two teeth have exchanged their places, which is not a normal thing. It's a malocclusion. Now, coming to the inter-arch malocclusions, we are going to see in the anterior-posterior, vertical and the transverse plane. Now, when we come to the sagittal plane, we can see it is of two types: pre-normal and post-normal. Now, pre-normal occlusion is when the mandibular arch is forwardly placed more when the teeth meet in centric relation. Pre-normal malocclusion is nothing but it's a class 3 occlusion, and post-normal occlusion is when the mandibular arch is placed more distally. So, post-normal occlusion is class 2. So, we can see in the diagram here, pre-normal on the right side, is a class 3 when the mandibular arch is more forwardly placed, and post-normal occlusion is class 2 on the left side, the upper diagram, which shows that the mandibular arch is more distally placed. Now coming into the vertical plane, we can see there is deep bite in the first diagram on the top and open bite below. So these are the malocclusions in the vertical plane in the interarch relationships. Coming to the transverse plane, it is nothing but when there is a scissor bite or cross bite. We can see here this is the transverse plane of the maxilla. Now when the maxillary arch is constricted in this plane, there will be a cross bite. So this is the malocclusion in the transverse plane. Now coming to skeletal mal relationships, it is compared between the maxilla and the mandible or the skeletal jaw bases. So it is basically of three types, class 1, class 2 and class 3. Here the diagram itself shows that when the maxilla and mandible are oriented, that is the maxilla is 2 to 4 mm ahead of the mandible, it's a class 1. In class 2, the maxilla is much forwardly placed as compared to the mandible. That is, the maxillary jaw base is more than 4 mm ahead of the mandibular jaw base. And class 3 is reverse. That is, the mandibular jaw base is much forwardly placed as compared to the maxillary jaw base. So now that we know about the intra-arch, inter-arch malocclusions and the skeletal mal relationships, let us see the first classification of malocclusion, which is considered to be the most oldest and universally accepted. That is the Angle's classification of malocclusion. So Edward Angle, he is also known as the father of modern orthodontics. He introduced this classification in 1899. It is the first and the most universally accepted classification system. He disorganized clinical concepts of occlusion into a more systematic approach to diagnose and treat malocclusion. Now Angle, how did he classify malocclusion, or based on which tooth? The tooth is none other than first permanent molars. So Angle considered that the first permanent molars are the most universally accepted to teeth while classifying malocclusion. Now what are the reasons? Let us see that. First permanent molars, they are the largest teeth, they are firm in the attachment, they have a key location in the arch, they determine the dental and skeletal vertical proportions, they are less strained in taking their normal positions, they control positions of other teeth, and they have consistent timing of eruption. So the first permanent molars are basically the teeth which show very less changes as compared to the eruption timings, or basically they have the greater anchorage value and they have a lot of advantages as compared to other teeth. So Angle considered first permanent molar to be the key tooth while classifying his malocclusion classification system. Now there are three classification systems as compared to Angle's classification of malocclusion. So they are class 1, class 2 and class 3. Let us study them. So class 1 is when the mesiobuccal cusp of the upper first permanent molar occludes with the buccal groove of the lower first permanent molar. Now we can see in this diagram that the mesiobuccal cusp of maxillary first permanent molar is perfectly fitting into the buccal groove. And here the relative position of the maxillary and mandibular dental arches mesiodistally is normal. Now Angle's class 2 malocclusion is where the relative mesiodistal relationship of dental arches is abnormal. We can see in the diagram that the maxillary arch is much forwardly placed as compared to the mandibular arch. And how do we define Angle's class 2 malocclusion? It is nothing but when the distobuccal cusp of the upper first permanent molar occludes with the buccal groove of the lower first permanent molar. Now when we come to Angle's class 2 malocclusion, there are two divisions and each has a subdivision. So there are two divisions, Angle's class 2 division 1 malocclusion and Angle's class 2 division 2 malocclusion. Let us see about Angle's class 2 division 1 malocclusion. Here we can see in the diagram there is a class 2 molar relationship. There are proclined upper incisors, the overjet is increased, there is narrowing of the upper arch and there is abnormal muscle activity. Now the next division is Angle's class 2 division 2 malocclusion, where again there is a class 2 molar relationship. We can see in the diagram, we can appreciate it on the right side. There is less narrowing of the upper arch. Now the key here is in Angle's class 2 division 2 malocclusion, the upper central incisors are lingually inclined or retroclined and the upper lateral incisors are labially tipped or proclined. So this is the main key feature that distinguishes Angle's class 2 division 1 from Angle's class 2 division 2. Of course, because of this placement of the upper anteriors, the overjet is decreased and there's a closed bite. Closed bite is nothing but an increased deep bite. And the perioral musculature is usually normal in Angle's class 2 division 2. Now, what do we mean by angles class 2 subdivision? Now, angles class 2 subdivision, if we can appreciate in both the diagrams on the right side, the upper diagram and the lower diagram. Now, in the upper diagram, we can see that there is class 2 molar relationship on one side, on the right side, whereas on the left side, there is a class 1 molar relationship. So, what did Angle say? Angle said that a class 2 subdivision occurs where on one side, the molar relationship or the malocclusion is class 1 and on other side, it's a class 2. Okay, so they can again be of two types, that is angles class 2 division 1 subdivision or angles class 2 division 2 subdivision. I repeat again, what do you mean by angles class 2 subdivision? Angle said that whenever we have a class 1 molar relationship on one side and a class 2 on the other side, it is nothing but a class 2 subdivision. It is further divided into class 2 division 1 subdivision or class 2 division 2 subdivision. Now in both the diagrams on the right side on the upper and the lower halves, we can see that it's a class 2 division 1 subdivision. The diagrams itself appreciated. Now subdivision refers to which side, class 2 or class 1. The same diagram, I have just put it up for your explanation purpose and I have circled it. So you can see in the upper diagram, the right side molar relationship is a end-on or a class 2. Whereas the lower diagram, the left side molar relationship is a class 1. So again, here how are we going to classify the malocclusion? It's a class 2 division 1 subdivision. And you're going to also write on which side the molar relationship is class 2 and on which side it is class 1. So here we have specified it nicely. On the right side it's a class 2 and the left side it's a class 1. Now angles class 3 malocclusion. Angles class 3 malocclusion we can see in the diagram. It is nothing but when the mesiobuccal cusp of the maxillary first permanent molar is located in the interdental groove between the mandibular first and second molars. So the diagram in the middle itself appreciates that the mesiobuccal cusp is located in the interdental groove of the lower first and second molars, and we can also see the striking feature that the lower arch is much more forwardly placed as compared to the maxillary arch. So that's a striking feature of angles class 3 malocclusion. Now angles class 3 subdivision is the same. When we have a class 3 molar relationship on one side and a class 1 molar relationship on the other side, it is called as angles class 3 subdivision. You also have to specify, so we have written it here, on right side it's a class 3 and on left side it is a class 1. So students, whenever you write about any subdivision, you always have to specify the right and left side also and write the molar relationships simultaneously on each side. So this is the diagram which will explain you better. As you all can see on the right side, it's a class 3 molar relationship and on the left side, it's a class 1 molar relationship. So this is the angles class 3 subdivision. Right side is a class 3 and left side is a class 1. Now, angles classification of malocclusion also has some advantages and some drawbacks. So we move on first to the advantages. Now what are the advantages? It is the most traditional, most practical and universally accepted method of classification. So even today, after more than 100 years, angles classification of malocclusion runs in the blood of orthodontics. We still use it even in our day-to-day purposes for explaining the molar relationship or as a communication tool between the fellow colleagues. It was the first to define normal occlusion in natural dentition. It was the foundation for future classifications. It is simple, practical and easy to apply in clinical practice. So even when you are practicing and the patient is in your OPD chair, you don't have to think. When you know the molar relationships, you can classify it easily as angles class 1, class 2 or class 3 malocclusion. Also, when they say that to everything as there is a drawback, there is a advantage. So now that we know the advantages, we are going to know the drawbacks or the limitations of angles classification of malocclusion. It considers only the antero-posterior relationship. No consideration is given to the transverse and vertical discrepancies. So whatever we have seen angles class 1, class 2 and class 3 malocclusion, it is all in the sagittal or the antero-posterior plane. Angle did not consider the malocclusions in the vertical and the transverse plane. The most important thing, Angle took first permanent molars as the key to classifying this malocclusion. But let's say you don't have the first permanent molars. They are extracted or they were grossly decayed or they were congenitally absent. What do? We cannot classify the malocclusion if the first permanent molars are missing. It cannot be applied to the deciduous dentition. So this is also a disadvantage because if you have any child which is in the mixed dentition, or let's say he has a deciduous dentition, you cannot apply Engel's classification of malocclusion. And it also does not highlight the etiology of malocclusion. So Engel did not explain why a patient has class 1, class 2 or class 3. So he couldn't exactly let all of us know the etiology of the malocclusion, although he classified it. So the next disadvantage is classification is based upon criteria of dentition alone, and it doesn't take into account the underlying skeletal relationships. It doesn't indicate the severity and complexity of malocclusion, and hence doesn't point out the need for treatment. So Angle did not exactly explain to us whether a class 3 is more severe or class 2 is more severe or a class 1, and hence it doesn't tell you exactly whether which malocclusion needs treatment at the earliest and how long will it take. It's a qualitative method and does not quantify malocclusion. So it doesn't have any numbering systems as such that you can tell about the quantitative classification of the malocclusion. Now, due to these drawbacks, there were few people in the Society of Orthodontics who thought of modifying Engel's classification of malocclusion. They challenged Engel's classification of malocclusion, they pointed out the drawbacks, and hence they decided to modify it in their own ways. So, the first is device modification of Engel's classification of malocclusion and Lischer's modification of Engel's classification of malocclusion. So, today we are going to know more about device modification of Engel's classification of malocclusion. So Device was the person who thought that let us classify Engel's class 1 and class 3 malocclusion. So the key here to know is Engel's class 2 malocclusion does not have a device modification. So let us move on to the device modification of Engel's class 1. The first modification, type 1, is when there is crowded anterior teeth. Okay. The next is type 2, where there are protrusive maxillary incisors. The next is type 3, where there is an anterior crossbite. Next is type 4, when there is a posterior crossbite. You can appreciate in the diagrams. And type 5 is when there is mesial drifting of the permanent molar. So device modification of Engel's classification of malocclusion in class 1. I repeat again, in class 1, there are 5 device modifications. They are type 1, type 2, type 3, type 4 and type 5. Type 1 is when you have a class 1 malocclusion with crowded anterior teeth. Type 2 is when you have a class 1 malocclusion with protrusive maxillary incisors. Type 3 is when you have an Engel's class 1 malocclusion with anterior crossbite. Type 4 is when you have an Engel's class 1 malocclusion with posterior crossbite, and type 5 is when you have an Engel's class 1 malocclusion with mesial drifting of permanent molar. Now, as I already told you, Engel's class 2 malocclusion does not have any device modifications. We move on to the device modifications of Engel's class 3 classification of malocclusion. In class 3, there are 3 device modifications. First, let us see that when viewed separately, the arches are normal. In occlusion, there is edge-to-edge incisor alignment suggestive of forwardly moved mandibular arch. You can see it in this diagram. So this is how your device modification of class 3 is. The first modification, the arches are normal when they are viewed separately, but when you occlude the maxillary and the mandibular arch, there is edge-to-edge incisor alignment. Now next is type 2, when you see the crowding and the lingual relation of mandibular incisors to the maxillary incisors. So we can appreciate in this diagram, the molar relationship is class 3, and also in the anterior portion there is crowding of the mandibular incisors and they are placed lingually as compared to the maxillary incisors. And the type 3 modification is when there is crowding and crossbite relationship of the maxillary incisors to the mandibular incisors. So again we can see there is a class 3 molar relationship here, and there is crowding in the upper arch or the maxillary incisors, and they have a crossbite relationship or they are lingually placed as compared to the lower incisors. So just to brush up, Engel's classification of malocclusion, in class 1 there are 5 device modifications, in class 2 there are no or 0 device modifications, and in Engel's class 3 there are 3 device modifications. So now that we know all that, just let us know the most important or the frequently asked questions based on this. First is they will ask you in your exam about Engel's classification of malocclusion, wherein you have to explain Engel's class 1, class 2, class 3, in which year did he give the classification of malocclusion with the diagrams. The next is you have to differentiate between angles class 2 division 1 and division 2 malocclusion. So you can explain it with the help of 4-5 points as we've already discussed. Then the next question is device modification of angles malocclusion. So all of you all know there are 5 device modifications in angles class 1 and 3 device modifications in angles class 3. And the last important question is the advantages and the limitations of angles classification of malocclusion. So I hope most of the things that I have explained you, you have understood and we have covered that. Do read about it and see you for the next lecture. Thank you.